I want to talk now about the roles of individual PERT team members, and in particular the physician, and as well as the licensed nurse. And I'll start with the licensed nurse. And I'm not sure if you're using LPNs, NRNs here. It doesn't matter to me, but whoever, typically a PERT team is going to have a nurse assigned to it. It could be on second shift a nurse manager, a nurse supervisor. That's the decision that's going to be made by central nursing, I would think. But their role is to know two things. Going in, whether or not that patient who is in crisis has physical problems that the PERT captain needs to know about. And also, are there PERT team members or staff on the floor that have potential problems that the PERT captain needs to know about? In other words, trying to plan for, make sure it's a safe response. What are some of the patient-related physical issues? Maybe the person has a brittle bone condition. Maybe the person has diabetes that's out of control right now. Maybe the person's on a do not restrain list. I don't know if your facility has a do not restrain list. I see some heads moving. Hopefully that's something that you keep updated all the time, that goes back to the medical staff. Your CMO maybe reviews that at least on a regular, minimally monthly basis, if not every more frequently. And that's part of what is in the back pocket of the PERT team captain or the nurse responding, that if you're going to need to do hands-on with someone, you know if they're on the do not restrain list. Because you don't want to go in there and break a bone. You don't want to go in there and if a person has a blood condition where they maybe have a coagulation disorder, that could cause a problem. So that information is real important for the PERT captain to know before they get into a full-blown response to the person in crisis. At the same time, there may be a coworker as part of on the floor, part of the staff, or part of the PERT team that has a known history of being diabetes that they've disclosed. As well as during the response, that nurse is responsible for eyeballing the person in crisis as well as the people responding. And the way you do that is you look for changes in blood pressure. The person's getting red. The person is a morbidly obese person, staff or patient. That there's a potential risk there for the person to have some type of dramatic physical reaction to what is occurring. The nurse is watching for that and is calling it out to the PERT captain. We need to do something quickly here. This person may be having some physical health problems, but it's communicating it. It could be communicating just as I've said it to you, or it could be coming up and tapping on the PERT captain and saying, this person is really physically in distress right now and has a history of cardiac disease or cardiac involvement. We need to do something different. So the nurse's role in this is to keep the PERT captain and the doctor involved about physical issues, not only with the patient in crisis, but also the staff member. The doctor involved who's responding, it may be the doctor on the floor, or I don't know how you're going to organize it here, or it may be the doctor who's carrying the PERT pager that day. But their job is to work with the PERT captain. If they feel in their observation that they need to authorize restraint, then they say to the PERT captain, I am authorizing restraint. Or if you feel good, saying, I'm ordering restraint. Those are words that the doctor would have to say. PERT captain takes that information to mean that if I need to use that strategy, I'm authorized to do it. But if I can come up with another way to quell the crisis, I'm going to do it. Or he may say, doctor, we're not there yet. Thank you for the authorization, and they continue to discuss it with the patient. This was a big debate at some facilities, and mine in particular, where the doctor said, I ordered the restraint. The nurse, who happened to be a PERT captain that day, didn't use the restraint, didn't put the person in. And the doctor was making a lot of noise about my order being violated. my response, and I'll say this to any of the doctors that want to do it, is have respect for the PERT process. Give your PERT teams a chance to manage the person in crisis. So that's largely how the doctor and the nurse are there to monitor the patient and the staff. The doctor's there to authorize the use of restraint, or if you're still using seclusion, authorize the use of seclusion. But that order is taken by the PERT captain is only authorization if it's needed to use it. We talked about the role of the PERT captain. We talked about the role of the nurse and the doctor. The other PERT team members take their direction from the PERT captain. They don't move in on a patient unless they're told to do so. When they come on the scene, when the PERT captain comes on the scene of a crisis, as I said earlier, two things are going on. They look to see if there's a physical confrontation going on. If there is a physical confrontation, they try to separate the patients. They directly get involved. You can't wait. You have to get involved. However, the other measure is if the person is, if the patient is just posturing, threatening, yelling, screaming, and that gives you a time, gives the PERT team time to satisfy the area, clear away any potential weapons, to move potential victims out of the way, other patients who may be just watching this and wondering, particularly if they're new to the unit and hearing all this noise. You turn off the TV, you may turn the lights down, you try to reduce the noise level, you try to calm the area. That's what the PERT team is doing automatically. Let me talk about the best practice was to provide a planned response to potential psych emergencies. I don't think I covered this, but that's commonly referred to PERT assist. And the way a PERT assist works is you have a patient with a history of violence. This would be one of the measures. You're a nurse on the floor, and the patient you are serving, hypothetically for this discussion, is a person with schizophrenia. He also has a problem with polydipsia, which is water intoxication. And part of that is you need to do some blood work with him. And you know that when you go to approach with that, when the lab tech, I guess you do have a lab service that comes in, when they come in to draw the blood, that's going to be an issue. That guy's going to see, she's going to see the syringe coming, and that's going to trigger violence. Well, that should trigger, knowing that history, a PERT assist. A PERT assist would be a call to the PERT captain saying that I have Greg Smith who's going to get blood work and I need a PERT assist. That then becomes a negotiation between the PERT captain and the nurse or the doctor. The doctor is directly ordering himself, but more typically the nurse, as to when the PERT team will arrive. In other words, you try to be considerate of the PERT team having other job duties. And if you can push it off to the closest hour, because maybe your group time runs on the hour from 9 to 10, 10 to 11, and so on, that 10 o'clock is the best time to do it, then that gives the PERT captain a chance to call the PERT captains. You don't do it over the pager system. You call them up and say, we have a PERT assist blood work, or PERT assist someone's going to be arrested. PERT assist, so-and-so is getting recommitment papers, and it could be an angry response. I mean, those are three typical. You may have others. You may have other patients, but that's how PERT assist works. The team calls the PERT captain on the day and negotiates a time for the PERT team to arrive very quietly to help support the team in the blood work and giving the bad news and whatever it may be, the commitment papers. And hopefully you know your patient and you know their history of violence. And the best predictor of future behavior is what? Past behavior. So knowing those men or those women who have a propensity to get excited when those things happen, you're going to be sensitive to it and you're going to plan your response instead of being reactive to that crisis. Questions about a PERT assist?